Today, we're going to break down a very specific kind of pain, one that can be really confusing and just relentless. It's called cervical radiculopathy. That's just the fancy medical term for a problem that kicks off in your neck but then decides to travel. We're going to unpack what's really going on and walk through the modern way to get back on track. So let's dive in.
So, does this sound familiar? You've got this pain, right? It starts in your neck, but it absolutely refuses to stay put. It's like it has a mind of its own, shooting or aching down your arm, and you just cannot find a comfortable position.
Maybe it's a sharp, nagging pain right between your shoulder blade and your spine, or a deep ache that just travels all the way down your arm. You might even have that weird pins and needles feeling, that tingling or numbness in your fingers. And does looking up make it flare up, but maybe tilting your head to the side gives you just a second of relief? And sleep? Yeah, trying to find a comfortable position can feel like an impossible puzzle. If you're sitting there nodding along, I want you to know what you're feeling is real, and it actually follows a very predictable pattern.
Okay, so what is actually happening here? Let's pull back the curtain and look at the mechanics behind all this confusing pain.
The easiest way to picture this is to think about the nerves in your neck. They have to travel from your spine all the way down to your fingertips. And to do that, they pass through these little tunnels between your neck bones, your vertebrae. Well, cervical radiculopathy is simply what happens when one of those nerves gets pinched or compressed or just plain irritated inside that tunnel.
And get this, your posture, just the position of your head, makes a massive difference. Now, this data is from the lower back, but the principle is exactly the same for your neck. Just looking up can shrink the amount of space for that nerve by more than 20%. On the flip side, bending your head forward actually opens that space up. This is so important because it explains why you might find yourself naturally wanting to tuck your chin. It's not a weird habit, it's your body being smart.
And we're not talking about a tiny, insignificant change here. Get this, research has shown that the amount of space available for that nerve can change by as much as 42% just based on your posture. That is a massive difference. And it totally explains why a simple head tilt can either give you sweet relief or a sharp, nasty spike in pain. This brings us to a really, really crucial point. This isn't just a simple pinched nerve. That's kind of oversimplifying it. To really get it, we need to see this as a three-part problem, where each piece of the puzzle is connected to the others. And this shows you that system perfectly. Think of it like a story with three main characters who are all in a bad relationship with each other. First, you've got the tunnel that the nerve has to pass through. That tunnel can get smaller because of something like a disc bulge, or inflammation, or even just the position of your neck. Character number 2 is the nerve itself. Because its tunnel is shrinking, it gets inflamed and super sensitive. And that brings in character number 3, the muscles. They feel the nerve freaking out, so they tighten up to try and protect it. But of course, that just makes everything tighter and puts more pressure on the tunnel. And you can see how this becomes a vicious cycle.
Now, this whole interconnected mess is exactly why some of the advice you might have gotten in the past just didn't work. It's not that the advice was bad, it's just that our clinical understanding of how to handle this has really evolved. Think about it. The natural instinct is to stretch something that feels tight, right? But what we now understand is that trying to force a stretch on an already inflamed and irritated nerve can actually make it even angrier. And sure, stretching those tight muscles might feel good for a minute, but it's not getting to the root of the problem. The real cause is the nerve irritation that's telling those muscles to tighten up in the first place. So the modern approach is totally different. It flips the script. The focus is now on calming that nerve down first, and then gently, very gently, helping it get back its natural ability to slide and glide freely.
So I really want to pause here and say this. If you've gone through that frustrating cycle of trying things that just seem to make you feel worse, please know it was not your fault. A lot of past approaches were focused on the symptom, like that muscle tightness, instead of getting to the real underlying cause, which is that irritated nerve.
All right, so how do we actually break this painful cycle? Let's walk through what a modern recovery plan looks like. It's a logical, step-by-step process that addresses the whole problem. Recovery is a journey, and it's usually broken down into 3 main phases. Phase 1 is first aid. The only goal here is to calm things down. We want to reduce that inflammation and ease the symptoms, often by finding positions that open up that nerve tunnel. Once the pain isn't so constant, you're ready for phase 2, rehabilitation. Here, the focus totally shifts to restoring that nerve's ability to glide and slowly reintroducing healthy movement. And finally, there's phase 3, the performance phase. This is all about building back your strength and function so you can make sure this doesn't happen again.
All right, this framework is great, and it gives us a clear path forward. But it also brings up a really practical question. At what point do you need to go see a professional about this?
And here's the most important advice I can give you on that. You do not need to wait until it's bad enough. Please don't wait until the pain is unbearable. Nerve problems especially respond so much better when we catch them early. Getting a proper evaluation, even if your symptoms seem kind of mild right now, can be the difference between a small problem that's easy to fix and a massive one that takes over your life.
I want you to think of this as your personal decision-making guide. It's like a traffic light system. In the green zone, you've got symptoms that definitely warrant a professional evaluation, but it's not an emergency. We're talking about things like pain that messes with your sleep or a patch of numbness that just won't go away. The yellow zone is a step up. This means you need same-day urgent care. This is for more serious signs, like your arm is getting progressively weaker or you're starting to have symptoms in both arms. Then we have the red zone. These are true medical emergencies that mean you go to the emergency room right now. We're talking about things like losing control of your bladder or bowels or a sudden dramatic loss of strength. Use this chart to help you figure out what your next best step should be.
So if there's one thing to take away from all of this, it's this. Real, lasting recovery from this kind of nerve issue is not about gritting your teeth and pushing through the pain. It's about understanding what's happening inside your body and learning to work with it, not against it. By addressing the tunnel, the nerve, and the muscles in the right order, you create the perfect environment for your body to heal itself. Ultimately, it's about shifting your mindset from fighting the pain to finally understanding its message.
So let's bring it all home. Here's the bottom line. If you are going through this right now, I really want you to hear this. Your symptoms, they are 100% real. They are not just in your head. And they are not random. They follow very predictable patterns, all based on that three-part problem we talked about. And that means, and this is the most important part, that with the right approach, an approach that understands and respects those patterns, recovery is not just a hope, it is absolutely possible.